Hey, future nurses, NurseEdScholar here. Today we're going to dive into the critical topic of hyperkalemia. This is when the serum potassium level exceeds 5 milliequivalents per liter. So we're going to uncover the causes, assessments that nurses perform, nursing interventions that we're going to anticipate for managing hyperkalemia. All right. But first, before we talk about hyperkalemia, let's briefly talk about pseudo hyperkalemia. And so, what that is, um, it's a condition where when we draw the potassium level or even lab during the collection, it can cause cell lysis. So meaning that, the cells break. And so it can create an elevated, or I guess you can say a fake, the pseudo is fake, elevated potassium serum value. And if you look at the patient and you're looking at this potassium level and you're like, something is really off because the patient isn't presenting any kind of clinical symptoms. So that means that potassium level should be redrawn and reevaluated just to make sure, is this a real value that we have to um, act on? Okay. So, what are the causes? Causes of hyperkalemia. Now, this could be from an excessive intake to decreased excretion and even intracellular fluid shifts. So, when we're talking about excessive potassium intake, that really means an over ingestion of potassium containing foods or medications, such as potassium chloride or salt substitutes, or even a rapid infusion of potassium containing IV fluids. A decreased potassium excretion could be due to the patient receiving potassium sparing diuretics. They could have kidney disease. Um, they could have adrenal insufficiency, such as Addison's disease. And finally, hyperkalemia can be caused by a movement of potassium from the intracellular fluid to the extracellular fluid. And this can happen because of tissue damage, acidosis, uh, hyperuricemia, and hypercatabolism. But the main thing that you need to know when it comes to potassium imbalance, especially, hyperkalemia, is that it can cause cardiac dysrhythmias, leading to cardiac arrest. So that's why it's so important, as nurses, that we evaluate and we monitor our patients' lab values. And, for this, especially the potassium. Okay, so now let's talk about how hyperkalemia can manifest during assessments. Okay. So in the cardiovascular assessment, you'll be looking for signs of slow or weak, irregular heart rate, a decreased blood pressure, and dysrhythmias. And when you're assessing for signs of hyperkalemia in the respiratory assessment, it'll include profound weakness of the skeletal muscles, leading to respiratory failure. Okay, so these are serious things that can happen. So we really have to assess our patients well. Now, in the neuromuscular assessment, um, early signs of hyperkalemia could be muscle twitching, cramps, paresthesias. Late signs could be profound weakness and ascending flaccid paralysis in the arms and legs. So it's very important when we start noticing the twitching or the muscle cramps that we really start assessing our patients and calling the provider so we can perform these interventions because we definitely do not want these late signs of hyperkalemia. Now, looking at gastrointestinal and lab assessment findings, as you are assessing your patient, you're looking for increased gastric motility, hyperactive bowel sounds, and diarrhea. Um, when you're looking at the laboratory findings, you will note a serum potassium level greater than 5 milliequivalents per liter, and you'll see EKG changes, such as tall peak waves, flat P waves, widening QRS complexes, and prolonged PR intervals. Now, we're nurses, so we're doing all of this assessment. We're gathering our information. Now, what interventions are we going to perform? And, we don't order medications, but we can definitely anticipate and be proactive and know, this is what I'm expecting the provider to order. So nursing interventions will include discontinuing any IV potassium, withholding oral potassium supplements, initiating a potassium restricted diet, preparing to administer potassium excreting diuretics if the renal function is not impaired. And if it is impaired, if that renal function is impaired, then you're anticipating to administer sodium polystyrene as prescribed. And what polystyrene is, it is a cation exchange resin. But basically, it promotes gastrointestinal sodium absorption and cause potassium excretion. Okay. Now, what are some preventative measures? Prevention is key. So, but, you know, what can we do well, not we, but what would we anticipate to be ordered to prevent hyperkalemia to cause these cause cardiac dysrhythmias leading to cardiac arrest. We are going to prepare the client for dialysis if the potassium levels are critically high. We're going to prepare to administer IV calcium if hyperkalemia is severe to avert myocardial excitability. So we're going to give IV calcium to kind of ward off, the heart I guess, the irregular activity of the heart. We're going to prepare for IV administration of hypertonic glucose with regular insulin because we're giving insulin to move the potassium out of the bloodstream back into the cells. And the reason why we're giving glucose is because um, the regular insulin, and I forgot to put insulin on here, but the regular insulin will lower your blood sugar levels. So you want to make sure that your blood sugar levels are high enough to, sustain this insulin that you're about to give the patient to try to push the potassium out the bloodstream back into the cells. Now, one thing that you have to note, if we have to give the patient a blood transfusion, and the patient has a potassium imbalance, the client should receive fresh blood if possible, because blood that has been stored for blood transfusions may elevate a patient's potassium level because the older blood cells have started to break down and potassium is released when that happens. So, to prevent that breakdown of the blood cells and having that potassium in there, in the blood itself, and we're administering it to a patient that already has high potassium levels, we want to avoid that by giving fresh blood because fresh blood hasn't started breaking down yet. We're going to um, we're going to educate the patient on avoiding any foods that are high in potassium, like citrus fruits or bananas. Um, and we're going to instruct the client to prevent using any kind of salt substitutes or anything containing potassium, and let them know that their potassium level, their serum potassium level, will be closely monitored, especially if they're taking a potassium sparing diuretic. So there you have it, a short um, and hopefully comprehensive um, insight into hyperkalemia. We looked at the causes, we looked at what to assess, we looked at the nursing interventions. So as future healthcare providers, you're really going to have to be equipped of assessing for hyperkalemia and knowing what interventions to anticipate. And, after we, perform an intervention, we want to make sure that we are evaluated and what are we going to be looking for because patients should get better. Okay. So with that, stay curious, stay passionate about, this nursing journey, keep learning, and please like, click, and subscribe. So thank you for watching Nurse Ed Scholar.